I'm Dr. Anthony Maloof of Eyes and Faces and Corneal Oculoplastic Surgery in Sydney, and welcome to this video on a more aesthetic issue. What are eye bags and how do we get rid of them? Well, people use the word eye bags all the time. I don't really like it. It's descriptive, but if you see these pictures, you'll see, yes, it does look like a bag. I'll give you that. But in fact, it's so much more than that. But patients come in all the time and complain of them. The difficulties here is there may be some underlying problems like thyroid disease, Graves' disease can cause this. But let's assume you have no underlying disease process and you have eye bags. Well, what they are a chronological change of the face. That's a nice way of saying age-related change. They are appearance of fat, loss of muscle tissue, thinning of the skin, descent of the mid-face to reveal the natural fatty tissue around your eye. That's what eye bags are. So patients will come in and say, I want a blepharoplasty, and I'll often reply to them, I don't know what a blepharoplasty is. So let's look at that word. Bleph means eyelid, plasty means change. So technically speaking, if I press on my face or eyelid, that's a blepharoplasty. But what they're asking for is they want to get rid of that and those eye bags and have a more rejuvenated appearance. And I fully understand that. The eye bags make you look old and tired and you want to look refreshed. The problem is that one word, blepharoplasty, brings with it the concept that there is one procedure, and there is not. So I don't have one surgical procedure to get rid of eye bags. I have a procedure which I will have to change depending on your individual needs. So let's have a look at a gentleman in his 60s with prominent eye bags. He's a male and he didn't like them. He didn't have any underlying disease process, and this is what he looks like before surgery. Now, to get rid of this, and I don't want to overcorrect it, I want it to look natural, was a very long and complex process where I had to actually operate on several layers beneath the eyelid, including the muscle and the fat, to restore it. And here's what he looks like at just 1 week. I'm very happy with it, as is he. He's got a nice symmetrical appearance. However, I always tell patients operating on the lower lid and cheek is the most difficult part of the face. I can do a facelift, neck lift in the same time as it takes to do that. It is very difficult, and unfortunately what that means is there's a lot of problems, and I'm going to show you 3 that were sent in to me that we've had to fix. This first lady has had 2 cosmetic surgical procedures. She had both eyelids done and both corners droop, and women hate drooping of the corner of the eyelid or rounding. It really riles them up. She had attempts to fix it and failed. So I saw her and had to do quite extensive work to give her that nice sharp angle, and you'll see after surgery it looks normal, looks lovely. That is the first case. Here is the second lady who's had surgery on both lower eyelids, and her right lower eyelid was droopy. She had it repaired and it failed. In order to fix it, I had to take her back to surgery and do quite extensive lower lid work to lift up this area to achieve an aesthetically pleasing result, which you can see here. Finally, I want to show you another patient who's come in after having both lower eyelids done, and unfortunately one side had extensive work and damaged the nerve fibers. This is going to be very difficult for me to repair, and I as yet have not repaired it because we still have to wait. But the key factor is the muscle has been permanently damaged. So lower lid blepharoplasty is a very complicated procedure. There's no one way of doing it. It has to be done right, and when it's done wrongly, it causes all sorts of anxiety. Factor that in if you are thinking about it. Thanks again for watching. I'm Dr. Anthony Maloof of Eyes and Faces and Corneal Oculoplastic Surgery in Sydney.